Hi, good morning, everyone. It's so wonderful to be with you today for the next installment of our Take Heart Ambassador Training Series, talking today about compassion in action, school-based mental health advocacy strategies and tips. I'm Dr. Martha Staley. As Ingrid said, I'm the director of the New England MHTTC School Mental Health Initiative. Our mission with the Take Heart Ambassador program today is to help spread the word about the importance of comprehensive school-based mental health services and the importance of the collaborations between school communities and other community supports and stakeholders, including community health agencies. If you would be so kind, we would love to know where you are joining us from today and who you are, what your role is. So if you could put your name, location, and what you're hoping to learn in this session in the chat, that will help us make sure that we are delivering the answers to your questions. So again, today, our goals are to engage stakeholders, to turn naysayers into allies for comprehensive school-based mental health, and to help everybody in school communities and beyond to help advocate for our kids and educators and school staff. So again, please, I see some people are already doing it. Please put your name, location, and what you're hoping to learn today in the chat for us. After today's session, we will have office hours. So please bring your questions, challenges, solutions, celebrations, or anything else that we didn't get to in today's session to that time after the session for some office hours with our speakers, Ingrid and Michael today. Our goal is to help schools cultivate compassionate school communities that help buffer against the negative effects of trauma, help build resilience for all students and all members of school communities, and to help those of you working in schools with stress relief and to help prevent burnout. Our HEART Collective is supported by the New England Region's TTC network, including the New England Addiction TTC and the Prevention TTC, as well as our own mental health TTC. We've talked a lot in this series about creating a compassionate school community. So what does that mean? It's about having all members of our school communities have a deep understanding of the neurobiology of trauma and stress and how it affects all of us and the children in our care. It's compassionate school communities also understand the benefits of mindful approaches to transformational leadership. And in compassionate school communities, we think about how community collaborations can help support a more comprehensive, equitable, compassionate school mental health support system. One of our goals is to vision together with all community stakeholders, from students to families to school staff and community members, to help create this vision of compassionate school communities. So now it is my delight to turn it over to our first speaker, Ingrid Paget. Ingrid.
Hey there, thanks, Martha. So it's my pleasure to join you today and talk a little bit more about what do we mean when we actually say compassion in action. So you can go to the next slide. So really putting compassion in action is about having an understanding of a problem and empathy for the suffering of another. That's really what propels us to connect with and help. So in honor of kind of Women's History Month, you'll see some intentional points today to educational leaders like Marian Wright Edelman on our next slide. One of the things that we can do to honor the humanity of everyone is to learn to be quiet enough to hear the genuine within yourself so that you can hear it in others. And I like that so much, I almost want to read it again, right? Learning to be quiet enough to hear the genuine within yourself so that you can hear it in others. And that's one of the main strategies that I want you to carry forward as you're looking at ways to build and increase stakeholder engagement. So it really all comes down to the fundamentals. So setting the groundwork for successful stakeholder engagement is all about knowing and understanding your audience, but also setting engagement goals. And those goals could be awareness, education, engagement, involvement. It might advocacy. It might be a few of these, or none of these. It may be different goals that are respective to your community. But once you have your engagement goals, you then want to choose the appropriate communication channels to reach your audience. And then, of course, listening again to your audience needs and concerns, and measuring outcomes and evaluating your efforts in an ongoing and systematic way. Again, I really believe that empathy is the secret to building an authentic relationship based on trust and understanding. And so in the context of stakeholder engagement, that includes acknowledging, respecting, and taking into consideration another person's viewpoint and input. Public participation is a process, and communications is a science, and it involves the public in problem solving, but more importantly, actually using that input as a part of your decision making. Next slide. So again, in terms of understanding your audience, that really plays an integral role in shaping your engagement plan and communication strategy. Who is your audience? What do you know about them? What are their demographics? And also another piece that I wanted to point out is something that communication strategists call psychographics. It's really a way of segmenting your audience according to their attitudes and aspirations. So what are their issues? What are people going to care about? What's also going to get people upset? Because in this work, there's some sort of risk management required. Is there the potential for outrage around some of these topics? If so, you need to plan ahead with a crisis communication plan. And developing a crisis communication plan isn't something that you do in a crisis, right? It's something that you consider and build into your overall engagement plan and communication strategy. I want to tell people too that, it's not that meaningful engagement has changed over the years. What really has changed are people's awareness of what it means to engage in a meaningful way, the number of organizations that are doing engagement. So for this reason, it's really important for educational communities to kind of take some nods from what's going on in PR firms, what's going on in the communication avenues, because stakeholders are demanding that kind of presence and knowledge. Next slide. So you really want to choose the appropriate communication channels. I know these days we're all Zooming, which is a culture in and of itself. But as we return to schools and meetings and town halls and other gatherings, it's really important to find ways to build trust with stakeholders. And sometimes that's difficult to do via a Zoom meeting. But you want to initiate engagement early. You want to develop a respectful discourse and ultimately collaborate with the community in your decision making. But being aware of how your audience likes to communicate and then choosing the appropriate tactic is an essential step in the engagement process. So I really like this. This is a quote from Epictetus, a Greek philosopher. We have 2 ears and 1 mouth so that we can listen twice as much as we talk. But I have to say, when I hear this quote, I don't hear the philosopher. I hear my grandmother. And so it's something that I've heard all my life, and it really drives my interactions with people on a daily basis. So I wanted to point out that successful engagement is really more about being a good listener, and that involves taking into consideration your audience views, opinions, and concerns. So whether it's at an open house or at a kitchen table, stakeholders want to be heard, and more importantly, they want to be understood. And so that's why research is important, and setting specific goals, creating an engagement plan that's really tailored to your community, involves listening to that feedback, and it really sets the tone not only for effective communication, but more importantly for meaningful stakeholder engagement. And so again, at the end of the day, people won't remember what you said or did, they'll remember how you made them feel. And that's a quote from Dr. Maya Angelou. And so there are all kinds of ways to measure stakeholder engagement. There are counting methods, right? The number of people who attended a meeting or who downloaded a fact sheet. But really, the construct measurements are what I believe drive success. So the degree to which participants felt they were part of a positive community, the degree to which participants feel comfortable sharing their thoughts and concerns, and the level of confidence they have in the overall process. So I'm going to listen a bit more than I talk, but I want to wrap up by saying there are kind of 11 engagement principles, and I won't walk you through those here, but you will receive today's slides and a compassion and action toolkits with guidance on ways to focus on community relevance. right? Acknowledge the community. Ways to disseminate findings and knowledge gained to all stakeholders. Ways to seek and use the input of community partners, and to really involve a cyclical and iterative process in pursuit of your objectives. You want to foster co-learning, capacity building, and co-benefit for all stakeholders, and also build on the strengths and resources of your community. That will help you to facilitate collaborative, equitable partnerships, integrate and achieve a balance of all stakeholders, involve all stakeholders in the dissemination process, and then plan for a long-term process and commitment. And so with that, it's my pleasure to turn today's session over to Dr. Michael Fain, my colleague and friend. To share a little bit more about the importance of advocacy and share some stats. Michael?
Sorry, I was on mute. Good morning, everyone.
You have to put a quarter in the jar.
All right. I'll give you 50 cents. Thank you, Ingrid
Yes.
and Martha, for inviting me today. This is one of my favorite topics, that of advocacy, especially for this particular community. I'll start off, I'm a researcher also. And so I couldn't do anything without some sort of statistics this morning. According to the National Association of School Psychologists, it's estimated that at least 20% of children demonstrate some type of mental event, health event throughout their trajectory in school. Um, uh, that could be for a number of reasons. Bullying, I had a bad morning, my parents were up all night celebrating or partying and doing drugs, and the list goes on and on and on. Again, this roughly estimates to about 1 out of 7 children when we talk about this 20% here. Obviously, there's understaffing in schools that continues to be a major problem. And I think that we can't say enough about the importance of pushing the powers that be, if you will, to produce the funds that we need to enhance the staffing issues that we have. I think it's safe to say that every principal in a school, every superintendent of a district could easily say, well, my school, my district never has enough. I don't care how much money we provide. And wouldn't it be awesome, I guess, in some kind of utopic spirit that we had one teacher per child in our school system, but we know that that's not going to happen. So we have to continue, again, to find unique ways to deal with this understaffing in schools. We also are compelled to recognize that just like our physical health, if you will, our mental health, our mental hygiene, which encompasses emotional, psychological, and social well-being, is essential to student successful participation in school. And I like that particular bullet because, especially after what we had to deal with during our early time with COVID, for children and parents who are trying to navigate this new virtual world, if you will, educating, I can only imagine what it was like in that household. Um, and so can you imagine what it's like to be in a household where a parent is trying to work and deal with this new concept of working from home, and then have a child or children who have a multiplicity of mental health issues, and I'm still trying to figure out how do I get them to be in a space of learning when I don't even know how to navigate this myself. Next slide, please. Well, when we talk about backing up your position with the data, I think that we've come to a space in our society, and I know that we still have a lot of work to do, but this whole concept of data analytics is one that could not have come out at a better time. Um, in another hat I wear, I'm a dissertation chair of students who are pursuing doctoral degrees in data analytics, and just trying to get people to realize the power that comes with the numbers and that allows you to spell out how do I justify X uh, because of Z. And in that, I mean, how do I justify asking for more dollars when I don't have the background of the numbers that allow us to make these kind of administrative decisions. So I think it's important that we keep up to date, relevant data for a particular school community. I think that there are a number of compelling incidents, datas, and stories that can be told here that, uh, well, it certainly tugs at someone's emotion. It is the fact that we have the story to share that makes it a little more personal. Ingrid, you think this is a good time that if I share that story I shared with you, or would would you like me to just move forward, keep
No,
moving forward?
absolutely. I think it's a great, and it will tie in well with the next slide.
Okay, great. So nothing occurs by happenstance, let's say that. And I'll share my personal story, and that is I grew up in a house with uh, two siblings, and one of my siblings I shared a room with for 18 years. That sibling, during his teenage years, started to have problems with depression. And my mother was a nurse, and she did what she needed to do to get the school system involved and to go through the IEPs, et cetera, et cetera. My brother, to make this a short story, gets through school, graduates, excuse me, graduates from high school and joins the United States Navy. While in the Navy, he becomes suicidal. And the depression that he had as a child crept into his military experience and led to him having a very dark time. Fast forward a couple of years, and I receive a call while I'm teaching at a university in Georgia that my brother has had a depressive moment that has taken him in um, uh, over the edge, if you will, and he's at a local hospital in Washington, D.C. I get to D.C. He has told the personnel that he is okay. They let him out 5 days later. I had to go back to Georgia to teach. And the day after I returned, my brother committed suicide. Now, there are a lot of pieces in between there that I left out the uh, for time's sake. But let me just say this: had it not been for the advocacy that my mother pushed when my brother was a child, he could have lost his life or taken his life much earlier. And so I think that it is important to recognize that we all have a story to tell. And again, not to make this um, solely to pull at the emotions, but on the previous slide where I talked about the number and stories connect in such a way that they promote action. I want you to remember that data isn't just about the numbers, but about the stories. And mental health challenges have lasting impact on our daily lives. How can you connect your what you ask to the impact? Next slide, please. But I will say this, we all can do something. Oftentimes we sit back and we hear these stories on the news. We hear stories in our community. And one might ask, well, what can I do? And I think that what we can do is make ourselves a committee of one and say, I'm going to do something, and this is what I'm going to do. Students who are mentally healthy and socially and emotionally confident usually have better academic achievement. And so I think that speaks within it, the message within itself, pretty self-explanatory. Ingrid, next slide, please.
Sure. And Martha, I wanted you to help us with this. I thought it might be helpful to just hear a message from Taylor Bryan Turner, the Assistant Regional Administrator from SAMHSA Region 1. And again, it's a similar message to kind of tie into what Dr. Fain shared, but to really bring home the point that schools are the hubs and all schools can support children holistically. So Martha, if you can share a bit of this clip with us.
Good afternoon. My name is Taylor Bryan Turner, Assistant Regional Administrator for SAMHSA, Region 1, New England. It is my pleasure to tell you about the Healthcare Workers and Educators Addressing and Reducing Trauma Collective. I think the name says it all. But first, I'd love to tell you a little bit about why the Heart Collective is so near and dear to me. So here I am, 5 years old, living in Brooklyn, New York, living in the projects or affordable housing, only child at the time before my 2 younger sisters come along. So I'm living my best life. When I was 8, my parents headed to New England to escape the Bedford-Stuyvesant projects for a safer life, a more equitable life, and access to economic mobility. Things were going according to plan, and mom and dad had great jobs. But when I was 15, there was a mass shooting at a local bar in Providence, Rhode Island, and a person under the influence shot through windows of a bar and several people were harmed. My father sat at the bar when a person got up, and a gunshot wound caused him to be wheelchair bound, a quadriplegic, paralyzed from the neck down for the rest of his life. His biggest fear was being incarcerated just for living as a Black man, and now here he is, a prisoner in his own body for the rest of his life. This caused me to be a young nurse, physical therapist, and extremely adaptable. I had to grow up fast, started working right away to help mom, and went to 3 different high schools because we had to move around a lot to provide that accessible housing to accommodate my father's needs. These are multiple traumas and had a major impact on my family, and I want there to be accessible mental health supports to all children, and the best place I can think of is in our schools. These are the resources that I did not have access to.
Thank you,
So
Martha.
why did we
And so, Michael, I thought this tied in really well to kind of our conversations around the importance of finding partners and the importance of dressing children where they are in schools, where, you know, kids are coming with multiple traumas oftentimes, as Taylor herself shared.
You're exactly right. I think that this, moving into our next part of the presentation, strategies for equity and tips and tactics are so very important. I think that when we talk about just on a wider scale, strategies and equities in mental health in the school system. This is no new conversation. In fact, this is like pouring old wine in new bottles, if you will. But I think that anytime we have an opportunity to retool our message regarding the different strategies and equity of that old wine, that old concept. It's better. We certainly don't use the same language that we used when we were talking about this issue in the 70s that we do in the 21st century. We've learned a lot, certainly, as we design these strategies for equity on how not to insult our friends, our colleagues in the school system, the very children that we interact with. So I think that it's sad to say that there are some teachers out here who, because they've never interacted with a Black or brown child, even though they have a teaching certificate, they might say the wrong things and not necessarily intentionally. Certainly, there's the argument that there are some teachers out there that are intentional in their unkindness, but there is a segment of our educators in the school system who just don't know out of a lack of experience. And that's why it's so important for SAMHSA to have this kind of program and webinar like we're having today. If I could see the next slide, please. So the strategies for equity, and I like this meme on the side, everyone in the school building has a responsibility to increase their awareness and recognize your biases and historical institutional impression. And I wanted to have that particular bullet because it's so important for us to open up and talk about bias. I don't know, somewhere along our journey, there seems to be this, oh, if we don't talk about it, it will just go away. Well, no, we know that that's not going to happen. And let's face it, in our homes, if there were microphones placed in our home and then the conversations played on the 6 o'clock news, I think that more than bias and embarrassment would come out. And so I think that this whole idea of being multiculturally aware gives us an opportunity to just deal with our neighbors, deal with those individuals we interact with in our grocery stores, and certainly the children in our community. And so that's why that bullet is there. I think that when we talk about our curriculum that we see for instruction in our schools, we've got to make sure that that curriculum is culturally responsive. So the argument could be said, well, Dr. Fain, I've never had a Black or brown student in a class, so I don't really need to invest my time in this multicultural experience. Well, what happens, teacher, when the following academic year, you have a slew of Black and brown students in your classroom? So your argument goes down the drain. I think that there are a number of inconsistencies in the support that we have in the school systems. And one of those inconsistencies centers around student behavior. And that is the behavior is maladaptive or aggressive. I think that there have been experiences that I've witnessed, and perhaps some of you have witnessed as well, when a child is misbehaving and the teacher automatically wants to squash that behavior by disciplining them and sending them to the principal's office and not taking that split second to think about what is the nucleus of this negative behavior. Next slide, please. I think as stakeholders, it's very important to recognize that punitive discipline practices, they don't help the student cope with whatever, as I said, the nucleus, the underlying anxiety that needs to be addressed that may be causing this issue. I think it's important to also recognize that students of color are more frequently punished through exclusion, just get them out of the class, that can escalate into expulsion, get the child out of the school. And I put here in some cases, but Ingrid and Martha and our guests, I think that we all can agree that there are a number of these cases that have led to young people being incarcerated, where if we started here at the escalating behavior in the school, we might not see this community of students behind bars. And so when we talk about equity, it's so important to recognize that, again, we all have a charge. We can all do something. And as we're advocating, I think it's important to recognize that it's essential that in any process that's been designed to help our students with their maladaptive behavior, we look at the perceptions and the environment in addition to the students' actions. Next slide, please. Ways to put compassion into action. So compassion serves as the foundation of the work that is being done in this webinar series. And then in the process, it brought us to this whole notion of compassion. And, you know, I oftentimes talk about, especially to my doctoral students, you've written this wonderful book that now we sign off on, and we give you these letters of doctor behind your name. But did you write this book that's going to just sit on your bookcase as a trophy? Or what can we take, or what can you take from that book which you have written and put your thoughts, your recommendations for future research? How can you put that in action? And so I think that it's important when we talk about this, putting the compassion into action, that we recognize that the culturally responsive services that are out there, not only should they stay, but they should exist in such a way that we're constantly trying to find ways to create curriculum, create classroom, create spaces where all parties who enter the room recognize that this is a safe space. This is a space that celebrates culture, celebrates diversity, celebrates all of those differences in the midst of learning. And so when we think about curricula that are responsive to students' cultural backgrounds, we need to think about the level of acculturation that their cultural values bring. You know, I've been in schools where a child is their first time going to a public school, in the United States of America. And so they're still learning how to acculturate in the system. Whereas there have been other students whose grandparents are immigrants, if you will, and have come into this system, and they've acculturated in such a way that they can serve as a peer, if you will, to that one student who has never been in our school system. When we think about providing culturally responsive mental health supports, again, it requires that we realize our biases and our stereotypes. Don't put them away as though they don't exist. Realize that they exist. Find ways to work around those biases and stereotypes and get to know people. My spouse and I were talking about when we bought our house 2 years ago, that we have this multiculturally diverse neighborhood, but initially the African Americans that live in our neighborhood were speaking to us. Our Hispanic neighbors were speaking to us, but our non-melanated neighbors were not speaking. And so with this gregarious personality of mine, I said, I'll be the nosy neighbor in the neighborhood and present myself in such a way that we're all inclusive. And this worked so much after our first year that we have a neighborhood block party, and we're bringing all of these families in our neighborhood out of their houses. And we're finding ways to recognize that we are more alike than we are different. And so I think that in celebrating the likeness, we sometimes put a cloth over the darkness of our biases and stereotypes, recognize them, and move forward. Next slide, please.
And now I'd actually like to spotlight myself and Martha so that we can kind of have a conversation about moving from stakeholder involvement to really stakeholder engagement.
Thank you, Ingrid.
Yes.
I'm struck listening to Michael talk about the importance of culturally responsive education and services. And I think that many people who may be new to the idea of comprehensive mental health, school mental health, might think, okay, well, what did those two have to do with each other? And I know that in our work over the last couple of years, we have really heard from our audience and also talked a lot about how equity is a key component of building comprehensive school mental health and comprehensive, compassionate school communities. I'm wondering if the two of you would talk about that connection to why this focus on equity is so important in building these compassionate systems.
I was actually thinking about that as you were presenting, Michael, particularly around strategies, because one of my real life stories is walking into the room, being a Black woman, you see me visibly, and you say to me that your school is all white, you don't need to learn anything about communities of color. Which, you know, on the one hand, in order for me to be able to have to swallow and have a conversation with you, I have to say, but we're teaching children to go out into a world that's diverse. And so the strategies that we bring into our homes, into our schools, need to be inclusive, but we all want to be treated as humans, right? So that whole child approach is really more about just humanness and kindness. And so that's one of the things that as a part of our childhood trauma learning collaborative with the New England MHTTC work, we had fellows that were learning compassionate school practices. And so having the interactions with those instructors and professionals and social workers and administrators over the course of 4 years, I actually could see our relationships evolving. And people who used to say, oh, we don't need to do that, are now saying, oh, Ingrid, help me to do this. I want to do it, and I want to do it in a way that is extensive and system-wide. So that's a big win for me and for our programming and for the schools and families that are being supported in that way.
I'm glad you shared that story. And again, as we said at the beginning, we all have a story. Whether you are melanated or whether you are unmelanated or non-melanated, I think that it's almost a tragedy, a travesty, to say that we're still having to create these trainings for something that seems so simple. But how awesome it is that we recognize that the trainings need to exist and the dialogue needs to continue. The work needs to move forward. And if we continue in this forward moment, then I think that we'll make strides and see growth, as you spoke of, Ingrid, just now. I don't want to get into this whole political discussion, but I will say this: as we talk about our advocacy in education, pay very careful attention to the state of Florida. That's all I'll say. Move on.
I just wanted to address something like you both have brought up so many important points. And I think talking about these subjects, talking about cultural, not only diversity, but building culturally responsive and culturally conscious systems, talking about mental health literacy, building comprehensive school mental health, it can feel totally overwhelming. And it's so big. Like I know that many of our people in our audience, I myself, I know Ingrid has felt like I'm just one person talking about this thing over and over again. The task ahead of us feels so large. And I guess that's why we have really wanted to focus on compassion in action and this action piece, this advocacy. And so what would the two of you say about to somebody who's like, great, but this is so large. Where do I start? What do I do?
Do you want to go first? Yeah.
Okay, thank you.
Yeah.
Great question, Martha. I think that the first part of that conversation involves saying, how do you eat an elephant, that elephant that's sitting in the middle of the table, one bite at a time? And we have to reach our audiences and our friends and our gatekeepers in such a way that they find that piece of this complicated puzzle, if you will, and move into that. I think it's safe to say that when we make it personal and look at our hobbies, we have hobbies because it's something that we like to do. In our advocacy efforts and in our training efforts, we have to find our friends who are interested and get them to recognize that the strength that they have is in identifying that one space, part of the space or part of the puzzle that they can work in, and then connect the pieces with someone else who has a part that they like and they like and they like, until you have this complete collective, a completed puzzle, if you will, and all the parts are touching and they're all working, if you will. Ingrid?
No, I agree with that so much. And I also, there's value in lived experience. And I kind of lean into some of the things that were taught to me growing up. And, as we talk about having this conversation about equity over and over again, my grandmother used to say, the world is going backwards, right? But the reason is because we missed a step.
Mm-hmm.
So I think it's important, like even in terms of allyship, because it's not just about communities of color, it's about, our LGBTQ brothers and sisters who are suffering. It's about rural neighborhoods that don't have access or have access issues. And so it's really about filling in the blanks. And you do that just once at a time, like just literally doing the work. And so I sometimes say, I may not be here, I'm a woman of a certain age, to see the success. But as long as I see movement,
Mm-hmm. Mm-hmm.
I feel like I'm doing something, as you said, Michael.
Mm-hmm.
Mm-hmm.
We all can do something. Find the do based on what you enjoy doing. Don't sit around thinking that you have to go to all of these different think tanks and all. And it's exciting to have these kind of webinars, but if you don't do anything, I hope that as our friends, you would consider saying to those who are in your group, so what are we going to do? What are we going to do? And then do it.
That's such powerful advice, and it makes me think of the example about making friends out of your neighbors. And it starts there, right?
Mm-hmm, mm-hmm. And think about it. So we work with these children in our schools who come to us with cultures, come to us with these socioeconomic issues. Come and then you put on their mental hygiene, or poor mental hygiene. Then you ask the question, so why do we need to be at a webinar like this? I think the question is already answered.
Thank you. Ingrid.
Oh, I think next, I wanted to involve our audience. If you have things that you'd like to, and we now have the ability to unmute ourselves. If you'd like to join our conversation, please feel free to do so. And I think our next slide, Martha, is actually our Q&A opportunity. Oh, Michael, you wanted to talk about kind of some ongoing impact options, and we can do that as we kind of have a conversation around identifying federal grants, that kind of thing.
Sure, and I'll make this quickly because we certainly would like to hear from our friends in the chat box. I think that there are a number of options that are ongoing that can facilitate us addressing our issue regarding compassion and the schools. I think that one way is to identify these grants that are out there for universities with education programs, with psychology programs, with social work programs that can partner with our low socioeconomic background communities to train mental health professionals. I think that this whole notion of forgiving student loans, I'm just amazed at how much it costs to get a college education now. And so why not be able to have a student's loan be written off or forgiven because they have decided to commit the early part of their professional career in psychology or social work or some aspect of mental health awareness. I think that when we talk about moving this message at whether it's the local, state, or federal level of our legislatures, I think that it's awesome to be able to see these programs that are popular in state capitals where you have an advocacy day. And in this instance, we would have our school mental health advocacy day and go to Annapolis here in Maryland and just talk to our representatives. Continue to talk, continue to talk, continue to talk, because it has been proven that the more we communicate and share our message, the more we're doing something that was awful in the 60s and 70s when I was growing up, and that was dealing with that stigma. Continue to talk because it reduces the stigma as well as the blame game. You know, and I'll make this quick anecdote, and I know there are those of you who want to talk. I was struck by the news story about the little boy in Virginia that had the gun. And that's why I put this blame game situation. So everybody blames the parent, and there's certainly some responsibility there. But according to the news accounts, someone in that school knew that the little boy had a gun. So let's blame the teacher. The teacher says she told the colleagues. The colleagues said they told the assistant principal. And so there's this blame game, if you will. I say, sit at the table, stop blaming, and come up with options that will make us successful in promoting this message.
That's such a wonderful place to pause, because it brings us back full circle to how Ingrid started us off, talking about the importance of communication, listening, acting, moving forward with empathy, the importance of thinking about your communication strategy. And strategy is a big term, but it can be sitting down with your neighbors, going to school board meetings, PTA, being involved, hanging out with your kids during sports, things like that. But beginning and continuing this communication, even when it's tough, even when it's uncomfortable, even when you're not sure how it's going to resolve. And Ingrid gives some really tremendous strategies for doing that. We are limited in the amount of time that we have for this portion, but I do want to remind everybody that we do have office hours right after this session for discussion, for if you can join us and get a cup of coffee or water and hang out with us and talk to us about how you are putting compassion in action. How are you beginning to eat the elephant? Or do you have tips to eat bigger pieces of the elephant at once? So I'm going to run through our closing slides quickly, knowing that we can come back to our discussion, because I want to honor those of you who have a commitment at 11. So this is just the beginning of conversations, and also a continuation of the conversations we've had over this series. So please stay posted for additional information about funding opportunities, how to support your own efforts, how to keep taking bites of the elephant, and how to participate in our Take Heart Week, which is in May, and is a way that you can get actionable steps every day to increase your own advocacy, your own ambassadorship. I want to remind you about the resources that are available through the MHTTC, all free, all evidence-based. There is a wealth of information for all members of school communities and beyond, those of you who are in behavioral health or clinicians. Within the MHTTC School Mental Health Initiative, we have the best practices guidelines for implementation to build comprehensive mental health, school mental health systems. It's a fantastic resource with a lot of supporting materials. And we also have Classroom Wise, which is an online free mental health literacy course for people who are working with kids. There's also a technical assistance opportunity if you're in a school and you want to do Classroom Wise with a larger group. This is a really great opportunity. There's a link in the slide that you can explore that. And we want to remind you about our own course that we've developed over our work in the New England MHTTC about cultivating compassionate school communities that respond to trauma effectively. And that's free. You can get 12 hours of CE credits. It's self-paced, lots of great information and resources and things that you can take back to your school communities and to help deepen your own practice. If you have any questions about any of this, please don't hesitate to reach out to Ingrid or myself at the emails. You will get all of these slides. And so now I am going to open it up for questions, conversation, thoughts, challenges for those of you who can stay. And those of you who are moving on to another event, thank you so much for your time this morning. We really appreciate you being here. I want to thank Dr. Michael Fain for his wisdom and expertise, sharing not only your lived experience, but the knowledge that you've gained over your years as a researcher and advocate. And I want to thank Ingrid, as always, for her tremendous wisdom in developing effective communication strategies and for sharing your own story as well. If you are interested in participating in May with our Take Heart campaign, Ingrid can tell you more about how to do that. Thank you so much for being here. Ingrid, tell us about the Take Heart Week.
Yes, I'm putting it in the chat and you can visit our website. It's heartcollective.info.